Welcome to the Friends & Co. podcast. Thank you guys so much for listening. Thank you for the support. This week's episode, we feature Leah Jaroslawicz, a pelvic floor therapist based in Williamsburg. My kids told me I'm not allowed to ask people to like and subscribe, so this is me not asking. Enjoy the episode. Leah, do we have to give a warning to people listening?
So I don't have to go into such detail, and there's so many aspects of pelvic floor therapy. So yes, I know.
No, but I think we should rate this, right? Like, is this 18?
18 and above.
18 and above? Men and women can listen to it, or just women?
Yeah, either.
I'm embarrassed to say I had no clue what a pelvic floor therapist was. I had no clue. And Erin's telling me, like, you gotta talk to my friend. She's a pelvic floor therapist, top of her field. I was like, I had to do a deep dive. And then the craziest thing is I spoke to people and they were telling me how pelvic floor therapy saved their lives.
Okay, that's good to hear, actually. I know. So I've been really trying to just get it out there of that it's a thing. Like, people don't really know about it. It's definitely becoming much more popular. I personally work in Williamsburg now, and there's waiting lists like you've never seen. There it is. Everybody goes to pelvic floor therapy. There's nobody that doesn't, which is amazing. But I feel like here in the 5 towns, it's not a thing yet. Maybe because it's less needed. It could be, but people don't know about it yet. Awareness is the biggest thing. I spoke on Achiezer. We did one thing with Dr. Herman, Euro gynecologist also, and I spoke a little bit just to get awareness out. But I feel like it's something that must be done. It's so important.
Can you tell us what pelvic floor therapists do? What role you play in the healthcare system?
Yeah, absolutely. Okay. So basically, pelvic floor therapy is a specialty, right? We have basically now it's only PTs and OTs who do pelvic floor therapy. There are other practitioners who can be licensed for it, such as midwives, nurse practitioners, but it's mostly OTs, PTs. It's really a specialty. I did extra schooling for it. I took courses through Herman and Wallace, and you become licensed to be a pelvic floor therapist. I started this about 8 years ago in Williamsburg. I worked as a regular OT. I used to work with kids. I finished school in 2013. I got my first job in Williamsburg. I worked with kids. I was always known as the therapist who was very into core. I was always doing parents would come to me and they would be like, my kid needs to work on handwriting and scissors. They can't cut. And I'm like, okay, no problem. And I would have them get down and do some core exercises and sit-ups and push-ups and work them. And I would get complaints in the beginning, and parents would be like, I really just wanted to work on the scissors. And I was like, there is no way that you're going to get a kid to be able to cut and write if they're slouched and they can't sit and their body can't even hold themselves up. So we really call the core is really the brain of your body. You can't function without your brain. You can't function without your core physically. So until they actually can sit up and hold themselves, they're not cutting and they're not writing. They're not doing anything properly. Usually once the core is in place and taken care of, everything else falls into place. So that was always my belief, even when I worked with kids. And then crazy, one thing after the next. And it was crazy how I ended up going into this, and I took one course on the next, and I ended up specializing in it. And I look back and I laugh that I even ever did that, because it's been amazing. It's been just back to back every day, day in, day out, and women, children, everything. There's so much to pelvic floor therapy that it's full time. I started as a solo. I was myself. We have another 2 PTs. We have a CODA. We have a PTA. We don't stop. We just can't get enough.
You were working as an OT. Why did you decide to become a specialist?
Obviously, things always happen one after the next, the same time. I was working with a kid, and at the same time, there was another male therapist I was working with. I was working with another kid, and the mother of that other kid calls me over, and she's like, I want to talk to you. And I was like, oh, I don't really talk to other therapists, other providers. We don't like to step on other people's toes, that's your provider. Maybe talk to him, and let's, I don't, no hard feelings. She's like, I just don't feel comfortable, and it's not about my child. I just need to talk to somebody, and I don't know who to go to. I'm like, oh, okay. What's up? And she calls me over to the side.
Leah's like, give me the scoop.
She calls me over to the side, and she starts telling me this crazy story that she had a few kids, and she had crazy, what's called a rectocele. We'll go more into that when we talk about what pelvic floor therapy really does, but it's basically a prolapse. Crazy pain. She had to get half of her colon removed. her doctor told her she cannot have any more kids. She accidentally got pregnant. It was just like, and it was like one after the next. She couldn't leave her house. She's like, I cannot leave my house because I have to go to the bathroom from the second I get out of my bed until I get back into bed. So I can't leave my house. And I have a family of children and I'm pregnant. Like, can you help me? And I'm like, no, like, I have no clue what that means. And I don't know what to do for you. Like, I can get you stronger. I could do like exercises, but like, I have no idea. Of course, at the same time, another PT friend of mine was like, there's this new course. They just came out with it. Herman and Wallace is starting this whole like pelvic floor track. We could specialize. It's so cool. We'll open our own thing in the 5 towns. It'll be so much fun. Let's do it. And I'm like, no, I am doing core. I am in Williamsburg. I am loving it. I am working with kids. I am rocking it. This is my thing. But like they both happened at the same time. The course was about to take place and they're always Saturday, Sundays. So like really hard from people to do this course unless they do, like you have to like arrange your own, get your own people, your own, it's really hard because it's always weekend courses because most therapists are working all week. So anyone who wants to specialize in it really has to go, over weekends. It's weekend after weekend after weekend, from Friday, Saturday, Sunday, from 8 to 4, 8 to 5, whatever, something like that. So she's like, I'm telling you, if you ever want to do this, it's something you have to do now because we're arranging a from course. And I was like, you know what? It can't hurt. I'll take a course. I'll use it. It'll be exercises. It's fine. This person's begging me for help. She doesn't know what to do. I said to her, I'm like, you know what? I'm going to sign up for this course. You'll be my guinea pig. I came to her with my loose leaf and my notes and we were reading page after page and I was having her get down on the floor and she's like, I'll do anything. Tell me what you need to do. And I'm like, okay, now try this. Oh, that hurts. Okay, maybe don't do that right now. And we were literally practicing. I never even advertised that I was doing this because after I worked with her and after I kept doing more training, it was just full. She just told her friend and her friend told her friend and the place was just like, we need something. We need help. And that's how it started. And it's just been going since.
And who should go to you? Like, meaning when I laugh, I pee at this point, right? So like,
you should
am I a candidate?
Yes. Well, okay. So let me go through, I'm going to go through like a little bit of who I see. First of all, I still see children. I actually just started specializing now in children. I've been only seeing adults until recently. And now I started seeing bedwetting, daytime wetting. I have a boy who I'm working with, a 13-year-old boy who had a tumor on his spine and, it ruptured and he has a neurogenic bladder, different things like that. So I've actually been only seeing women for the past maybe 5 years. And now the last 3 years, I've been seeing a lot of kids because it's easier to train other therapists on women and like have them treat them. The kids are a little bit more difficult. So that's one thing that actually I'm still working with kids and I'm still doing, all that kind of stuff with, even any syndrome, like anything, like when it's hard, with low tone or Down syndrome or anything, and they want to work on pelvic floor and they want to work on toileting and all these things. So I work a lot with that. So that's still with kids. Adults. So first of all, there's pelvic pain. I see people who, right after they get married, they have pain with intimacy. They really like, that's one of like, it's actually the simplest thing to work on. And it's like so gratifying because people think it's normal. They think it will go away. They get pregnant. They have a baby. They think things will stop. It doesn't. I mean, sometimes you're lucky, but they really sometimes just getting that help and really getting the muscles to work and figuring out what's going on and why it's going on and dealing with it. It's really a quick fix and something that's so not necessary for people to go through. So we have the kids, we have the newly married, and then we have the regular, any person who's going through a pregnancy, a delivery. Anyone going through a pregnancy, you reach 35 weeks pregnancy, automatically your muscles are stretching out, right? Everything's stretched out. So diastasis recti, I'm sure everyone heard of that because we're always trying to, get fit after and somehow we just look like we have that belly pooch, right?
That's when the stomach like pops out, right?
Which is normal.
And then it's time to go to Dr. Hoshander.
Listen, I don't want to take anything away from him, but, you can work on it together. No, it depends how bad. It depends what's going on. If you're coming with crazy diastasis and like it's, beyond repair and you want to get to zero, you got to go to Hoshander.
Is that like, what's crazy? Like when you stick your hand in your, like how bad? Do you know what I'm talking about?
Yeah. So there's two ways. First of all, everybody has it. Anyone who gets to 35 weeks pregnant, your muscles are stretching to a place where automatically you're prone to have diastasis recti. Now, your baby comes out, either your muscles come back together exactly where they were and weak and staying on the side, and now they're separated, and you have a big belly coming out of you and all your organs coming out of you. Or if you're using your muscles properly, they're coming back and they're coming back in, which is what we want. So how do you test it? There's two things that we test. We test how deep it goes in and how wide it is, right? Like if you're laying, you could check it up on YouTube. If you're laying on the floor and you come into like a sit up position, you put your fingers by your belly and you could feel the two sides of your muscles and you see where they actually end. It can either be, there are different kinds. Either you have your separation higher up, lower down by your belly button. They get separated, and we're also feeling how deep it is. The deepness is a lot worse than how wide they are, because if the deepness really has like your organs just coming out of you, like that's really what it is. That's like when people are walking around and they had their baby a year ago and they have like a big belly gooch and everyone's talking, is she pregnant? Is she not pregnant? I'm not sure. It really looks like she's pregnant. She's so skinny, but she has that belly. That's really like that deepness. It's like when your muscles just cannot hold you in and hold you back together. So I work with a lot of diastasis recti, a lot of prolapse actually, which is, if we're not pushing properly or, some people are just more genetically prone to it, but we can have your muscles do weaken, your bladder, your uterus, things can like actually physically fall out of you. When you go into the bathroom, like people tell me, well, this is like when they usually come to me, when they go to the bathroom, they all of a sudden feel like a little ball coming out of them. They're like, what's happening? And I'm like, that's actually your bladder. And we have to work. Now, it depends how bad it is. Sometimes we just do therapy and they're fine and they're good and it's great. And sometimes they need surgery. And as a therapist, I'll prep them for surgery to make the surgery last, to make it hold, right? Because like if you're just attaching mesh and you're attaching it to weak muscles, it just falls right out. So, we have different goals and depending what's going on, but either we're avoiding surgery or we're prepping for surgery. Now, the most common of what I do see is incontinence, either, just leaking anytime, any day, or jumping, people are going to the gym and like all of a sudden after they do jumping jacks or something heavy lifting, that everyone's running to the bathroom because they all just like leaked somewhat. Or it's like, oh, I know I'm going to the gym. Let me just put on a pad because I'm probably going to, pee all over the place. That's not okay. That means your muscles are not working properly and you're not using them properly.
What's the assessment process?
Okay, so I have two routes that I go. I have some patients who are like very uncomfortable and insecure, or, even it doesn't have to be an insecurity. They just feel like they don't want to. I give them a choice. Can we test internally and see what's going on, or only externally? I usually recommend doing internal and external assessment just to really see what's going on, because sometimes they'll think they have a prolapse and they really don't, or they think that they don't and they really do. But it's totally up to them, because there's all your muscles, like there's top walls and bottom walls, right? Like your stomach, we could get to your muscles internally or externally. Now to target your inside muscles is a lot harder if we're not going internally and whatever. But like, I understand that if people are not comfortable with them, people are not okay with it. I'm so understanding and I'm so okay with that. And I've worked with so many patients that I've never even done internal assessments and have done great and are doing amazing and are fine. And then there are so many people that come, at a much worse level and they're doing much worse, or there's different things going on where it's like, we kind of can only get to the next phase if we're going to do some internal muscle stretching, some internal muscle strengthening, some biofeedback so your muscles see what's actually happening. So it really differs based on the person. Like this thing, pelvic floor therapy is like extremely personalized. There's no one size fits all. There's no like, just do this, this program and like, you'll be fine. It's really just like targeting what is going on in your body, because you can be overcompensating certain muscles and those are too tight and you got to work on them. You can be, some muscles are too loose and you have to really work on strengthening them without over strengthening other ones. There's so much that could go on here, and it's very, very personalized, individualized treatment.
And what are some of those treatments? Like, could you walk us through some?
Okay, so I actually started a program where I work, where I have like a treatment model of what I try to do. So what we do is for a basic, obviously it changes because everyone's here for different reasons and everybody, needs different things at different times. But I have a basic 12-week program of working with your muscles, to get your muscles to the best way possible. So what I do is I consider session 1 through 4, you're lengthening, right? What happens is it's, let's say, I want you to think of it as like any other muscle. It's like your shoulder. It's like your hand. If you have a trauma to your shoulder, or, if you rip your shoulder and you have stitches or whatever it is, right? Which is the same thing when a person, like it's a natural process, and we're having babies and we're having stitches, and when we're going back to life, and like these muscles are just becoming looser and looser and looser and weaker and weaker. right? If you have a shoulder tear and you're not going for rehab and you're not working your muscles, you're not going to have full range of motion. You're not going to be able to use it. And it just gets weaker and weaker as we keep going. So what happens is with stitches, a lot of times we have like that tightness because like, we stitch something together and like all of a sudden it's like stuck and we kind of have to work on opening up and loosening. So the first phase of what I do from session 1 to session 4 is called like the lengthening phase. Sometimes people think like, oh, I'm just going to do Kegels. Like I pee like when I'm walking the streets, I'm just going to do Kegels. Actually, that could be worse for some people because it depends what's going on. If your muscles are too tight, which is making your bladder spasm and you're peeing yourself, if you're going to do Kegels, you're actually making it worse. So I work on number 1 is lengthening, opening up, massage. I do a lot of manual and massage. I do, I could do cupping. I do skin rolling. I do myofascial release, just, opening up your muscles. After we do the opening, then we go into phase 2 where we do like the strengthening and we get your muscles to go back. So, right, it's like imagine your hand, imagine your shoulder. We opened it up. It's not stuck anymore. It's not like that tension of like after having like a scar or surgery or anything. And then now that it's lengthened, it's open, we can work on getting it stronger and we can work on, using, full range of motion again. Imagine your biceps, right? Like imagine they're stuck in like a halfway position. If you're going to start adding weights to it, you'll never get to be strong because you have to get your hand to get fully open and then you could come into fully closed and then you could add weights onto it. So that's really how I work. I start off with lengthening. We open up your body. We open up your muscles. Most of my patients love it because they have their massages and they feel great after. Any body tension that you have is really getting released at that point. And then we work on strengthening, getting you through full range of motion. And then we'll add weights. Like that's the end is like plyometrics and weights and getting you to like get really strong and get your full body really just back to how it's supposed to be.
And this is the 12 weeks, just takes 12 weeks. And then they're like healed. That's it. They're good. Or they continuously have to do the work.
My goal is to teach people how to incorporate it into their daily lives, right? It's like, why don't you have to work out your hands and your feet every single day? Like, why don't you have certain exercises to do? Because you're actually using them every single day, right? You're carrying groceries, you're walking to the store, you're running around, you're actually using these muscles. Now, the problem is that when sometimes we have a trauma and we're not using our muscles properly, so we're making them worse. And then like we just kind of forget about them, they become loose and we have all these issues. So if you just learn how to use them in your daily life, if you're walking anyway, and you just learn to incorporate these muscles within your walk, game changer, you're changing your life. If you're going to the gym anyway, do it properly. Get these muscles involved. I have people who come to me, they're like, I work out. It makes no sense. I do heavy lifting. I do this and I still pee. I still have pelvic floor this. I still have this. And I'm like, right, you're doing it anyway, but you're making it worse. You could have 2 people in the gym next to each other. One is actually helping themselves and one is actually doing more harm to themselves. So it's really important to just know my goal is to teach you the way to use your muscles, the way to use your body. And then you just take it and you do it on in your daily life. I don't sit and do exercise all day. I tell my patients, they're like, I have to do this for the rest of my life. I have to do all these exercises. No, you learn to bring it into your daily life. You learn posture. You learn core usage. You learn to get your muscles. You do it along with your breathing. You do it along with your sitting. You do it along all day, every day. You learn to lengthen your muscles. You learn to strengthen your muscles. You learn to get your muscles to activate with your daily life. And then that's really what I call cured.
Do you have a LinkedIn profile? Are you getting the most out of it? Check out Share Media, the LinkedIn management service for CEOs of publicly traded companies and key industry leaders. Share Media offers customized strategy for LinkedIn success, enhanced professional presence, and effective engagement with your target audience. Transform your LinkedIn profile into a powerful tool for growth and visibility with Share Media. Ready to take your LinkedIn to the next level? Visit sharemedia.co today. Give me one example of one of those exercises that someone could just do from home.
Okay, so the first thing that I will tell you that I always start with, no matter what, you know how I said everything is individualized and everything's personalized? Session 1 is not individualized. Session 1 is for any single person that comes into my room or any person that I meet on the street, because obviously, like once I say my name and once I say what I do, I have all my friends in the neighborhood and everybody at the Shabbos table like, can I talk to you for a second? And it's like, okay, let's take a break now. Men out, women, let's go.
I love that. That's great.
But the first thing that I teach everybody is it's a course that I actually took. It's called hypopressive breathing. Anyone who wants can look it up. It is the most important part of life. If you do hypopressive breathing, you can change your life. All it is a breath. You learn how to breathe. You learn to relax your pelvic floor muscles to get them into a lengthened position. And you learn how to breathe out to contract and pull up all your muscles. So that to me is key. I tell my patients over summer, over Yom Tovim, whenever they're not in therapy, whenever they feel like they're making a wedding, they're making a bar mitzvah, they're so busy, they can't do their exercises. All I tell them is just do the breathing. Just do the hypopressive breathing. You will not fall backwards. And in fact, you'll probably even go forward. So that's the biggest.
What breathing is that? What's that breathing though?
Basically what it is you want me to teach it to you?
Yeah, I want you to teach it to me.
Okay. So what you're doing is you're doing a diaphragmatic breath in. I mean, yeah, you're taking a full breath in.
Okay.
You're doing it really, I start off with doing it laying down because that's gravity eliminating. So you have nothing pushing down on you. You have nothing pulling up. It's like the best position. You're laying down on your back. Your knees are slightly bent. Your toes are pointed upward. You're taking a full diaphragmatic breath in. Your whole upper body is releasing, like pulling in, breathing in. And then you're blowing out and you're getting your hip bones to come together and your belly button is getting pulled up. So everything that I told you that I work on lengthening and strengthening is all within this breath, right? You're taking that breath in, you're lengthening, relaxing your whole inside, and then you're blowing out and you're getting everything inside to come together and up. That's basically a little gist of it in a 30-second way. I did days and days of courses on this.
Wow. It becomes like a little bit of a therapy session, I'm sure. Well, breathing in and out, right?
Absolutely. All of a sudden you get the ins and outs of what's really going on.
How do you handle that? How do you deal with, the emotions that the client brings into the room?
That's a great question. I actually love it.
Have you ever had someone cry on the floor?
Yeah. And I've learned the first time I probably just got down and cried with them because I really wasn't sure about like what was happening and how to deal with this. But you learn to just hold a safe space. Like it's not about healing and making them better necessarily. It's not about being like, I get it. And that's horrible. And this, no, it's just holding a safe space. Listen,
love that.
There are plenty of times I send to social work, I'm lucky and I'm grateful that I have all these resources within the one clinic that I work in. And right upstairs from where I work is psychologists and therapists and social workers and psychiatrists. And there's plenty of times when I'll tell my patient, I want to work with you. Let's do it along with more therapy because you have a lot going on. And this is where we hold our trauma. You know how like people say like, I have a pit in my stomach. And they, oh my God, I have a pit. This is where we hold it. So our pelvic floor is like doing so much and it's holding so much and it's working on so much that like sometimes when we work on it and we try to release things, it just brings kind of like that held trauma up, which is normal and it's just okay. And, working on it, through like the mental health aspect and the physical aspect, that's what really just gets like a wholesome approach.
And is there any time where the patient's just not getting better? Has that ever happened?
I can tell you, now that you're saying that question, I have one patient who I worked with for so long. I remember I was like, I am not giving up. She would do well, like she would get better and then she would fall right back and then she would get better. And she was a very, very closed person also. Like I had like a hard time relating to her. I know like having a connection with your patient is actually key. There's no way that they'll get better if there's no connection to you.
Do women who go through menopause go to you? For the same reason?
Menopause is big because it's a lot of hormone changes. So all of a sudden you have all this leaking and you have all this pain and you have all this like more like everything's starting all over again. And it's like all these changes in your body. Yeah.
I just want to understand why no one talks about menopause. Like I have no clue what's ahead of me. I'm scared and no one talks about it, right?
Me too. I'm scared and I did so much research on it and I'm so scared.
Maybe that's why nobody talks about it.
I feel so uneducated. How did you get so educated in this?
You know what? It's really through like practice and it's really through my patients because you know what? Menopause is not something I've ever taken classes in. You know what? The truth is that educated in all these other areas, it's because I've taken so many courses. I've seen so many patients. Most people I'm seeing it in and out. It's the same thing. You could come to me. I could look at you. I don't have to do an assessment because I already know what's going on. You're peeing, your posture is off, your pelvic floor is off, you have weakness, we got to strengthen you, we got to, it's basically like it's the same. It's like, how do you know how to go to the bathroom? It's the same process over and over and over and over. But when it comes to menopause, I'm actually stumbled. I stumble a lot and I call doctors all the time and I'm calling health food stores because I know that there's so much more to know about that I don't know. And like, it's just when I have patients and I talk to them, what are your symptoms? What do you feel? What's going on? When did this start? Where do you at in your cycle? Oh, you're only premenopause. Oh, now you're going, so now you're getting your period once every, it's like everything is changing. And all of a sudden the hormones are changing. And I called one doctor and he's like, oh, menopause, big deal. That's what you go through postpartum. And I'm like, big deal? Like, first of all, it's not the same. And second of all, he's like, yeah, the hormones, the levels, you went through it. Everyone goes through it. It's fine. And like, I tell my patient and she's like, I had 10 kids. This is not what I felt like postpartum with my kids, but also it's a range, right? It's a range. Everybody has different symptoms. Everybody comes with different things. Everybody has their own little package and their own things of what they're dealing with. The same thing with pregnancy, delivery. Everybody's story is different. Shira, you have one story. I had 3 C-sections. I had 2 natural deliveries. I have my own stories. Sorry, you have there's no 2 stories that are the same. And I see with menopause, it's exactly the same thing. There's no story that's the same. And what I'm doing as a therapist, as a pelvic floor therapist, is I'm treating your symptoms. I'm just trying to get you to be the most functional and, live your life to the best of your abilities with whatever symptoms that this throws you.
Could you tell us about the field, the different options for working? You work in a private clinic. Is there also pelvic floor therapists work in hospitals? Are they also covered by insurance?
So actually, the reason why I still work where I work is because I work in a clinic where it's covered by insurance, and there's nothing like that. I keep saying, and pelvic floor therapy is it's a specialty. It is. And it's very unique, and it's a hard thing to get. It's a hard, specialty to go into. And it took me years and years to really learn so much about it. And it took me so much experience. Like, I remember my first few patients, the first year I was working, like, I had no idea what I was doing. And like, it takes so much practice and so much seeing and talking and building and working to really become good at what you do. And most people do it privately because they put so much work and they put so much effort into it. And the insurance companies really just pay like a regular therapist for it. It's regular billing codes. It's the same thing as, any other therapist. So in order to be able to do it, most people have to charge cash for it. Now, I work in a clinic where it's a federally funded clinic. So they have much higher reimbursement rates than anybody else, than any therapist. And I feel so lucky that I'm able to provide this service. And that's the whole goal of this clinic, is to provide top service through insurance.
How much money can a pelvic floor therapist make?
People will charge privately, between $250 and $500 a session.
And how long is a session? How many minutes?
Yeah, 45 minutes to an hour. But I'll tell you, the one thing is that the people who charge privately will give you an hour and a half. I can't do that. I have to give 30-minute sessions. But I can give you 30-minute sessions twice a week, split up. This way the insurance will reimburse for twice a week, but they don't do it based on time. So there's definitely a downside. Like, I can't give like hours and hours of my time, like, in one slot, but for the eval, I could give an hour, make sure I get everything in. And then every session is 30-minute session, but I could give it as often as they need.
Let's say someone wants to go into pelvic floor therapy, just working as you are. What's like around the number they can make? I don't know how much OTs make either. I have no idea. I don't know those numbers.
Well, OTs are basically, I would say around $100 an hour. OTs, okay. PTs. Pelvic floor therapy.
Give me an estimate. People want to know if they should go into this field. We got to give them a number.
I know the therapist that they hire where I work in the clinic is not high. It's probably $100 an hour. $100. Now, private, you can make $250 to $500 an hour.
Undergrad. Give me what that was. Where did he go?
I personally went to Boca. I went to Robertson Boca's program, so it was a year.
Okay. And you graduated with a BA in?
I graduated in a bachelor's in science.
Okay.
And then you can go from there. You can either start OT school or PT school, and that's a 3-year program. Both of them are 3-year programs. I personally went to LIU, and I loved it, actually. And then from there, I started working. I worked as a therapist, and then I went to do Herman and Wallace. I did, you start off with pelvic floor level 1, level 2A, 2B, capsule. It's like a whole, it's all these are like 3-day courses going into each part of it. And then you do whatever continuing education.
What's the total cost, roughly?
Well, OT school is $100K.
Okay, so 100K for OT.
Between 80 and 100, something like that.
It's a fortune, yeah.
It's a fortune.
Because it's private. You know that? Because it's private college. It's a fortune. It's such a ripoff. Yeah.
Anyone who went to downstate, it was probably 30K, 40K.
And then the pelvic floor?
And then this...
Roughly. Just give me rough numbers.
Let's say it's $1,000 per course. And we did 5 courses. So it's like around $5,000. That's not such a big... That's not so expensive.
And when you say continuing education, how often is that?
So you have to have 30 credits every 3 years. Like in order to keep up your license, you have to do it anyway. So obviously I choose courses that are within my scope of practice, right? I do all these pelvic floor courses. Now I'm doing a lymphatic drainage course, just all these different, there was one course on vitamins and hormone levels, one course on nutrition and diet and how it affects the pelvic floor. There's just all these, interesting different courses. One was exercise, different interesting exercises to engage your core. Just all these different type of stuff that I'll purposely choose instead of when I was working with kids, I was doing sensory integration and auditory processing and vision and all that kind of stuff. Now I'm doing more of this kind of stuff.
What did you want to be when you were a kid?
Not a pelvic floor therapist and not an OT.
Did you even know what that was?
No, I did not.
What do you want to be?
I feel like I wanted to be like a designer, a decorator.
All right, you were very artistic.
I was always very artsy. I've been doing art lessons since I'm a little kid. I love painting. I love decorating. I remember when I was in seminary, my mother called me and she's like, okay, what are we going to do next year? And she's like, maybe you should be a nutritionist. And I'm like, maybe not. And then she's like, maybe you should go for art therapy. And I'm like, that was like actually a big consideration. And then we just decided to do OT because it kind of incorporates anything that you want it to. You can go from OT and do anything. There are so many OTs that specialize in art, people who are sitting and doing art in their sessions, and kids and adults and physical and pelvic floor. Who knew? I just thought that like I had the most options when I went into this field, and I never looked back. Like, thank you, Hashem. I'm really doing like exactly what I want to be doing.
And do you recommend pelvic floor therapy to other people? Do people call you and ask you?
Absolutely. Absolutely. And I tell people what it entails. And some people say, this is not for me. I don't want to touch people. I don't want to go internal. I don't want to do this. This is not for me. And that's fine.
So what type of qualities would somebody who'd be interested in the field, what type of qualities would they need?
That's a great question.
Honestly,
it's about making people feel comfortable. Because like
giving them space, holding
their space,
holding space, just like the pelvic holds everything.
It does. It's holding all our trauma and all our everything. There's so much in it. And just, that was actually something that always, I think that's like my gift or whatever. Like, I like people. I like to interact with people. I like to, people feel comfortable around me. And I just think that's a really important thing, especially with such an uncomfortable field. And that's why, like, I always say, like, usually people will say that they don't want to do internal in the beginning. And then after 1 or 2 sessions, they'll be like, okay, I think I'm ready. Because the whole point is to get comfortable with them. And like, even as I'm doing internal with them, I'm schmoozing with them about their kids and how they're doing and what's going on, just so that they don't feel like it's so awkward and you're so normal and you're going inside. Like, it's so embarrassing. It's not embarrassing. When I went to school, how we learn? We practice on each other.
I wonder, you say that a lot of times you send your patients to the mental health department. Does it work the other way also? Like if a social worker, let's say, is dealing with...
Yeah. Absolutely. We do a lot of collaboration. And again, I feel so lucky. I'm able to do all this collaboration because it's all in-house. But like, I'll have, the psychologist come downstairs to me and be like, listen, I think like we worked with this patient. She's doing great mentally. I think now we need some physical support to help her, get to the next phase all the time. What
is something that you feel like everyone should know that's not out there that people don't know? What is one thing you would want to give over?
It's not embarrassing. This is an everyday thing. This is everybody. If I'm dealing with it and you're dealing with it and your neighbor's dealing with it, don't run away from it. Don't try to cover it. Don't try to think everything's okay. It only gets worse. As we age, it only gets worse. There's a lot of genetic factors. There's a lot of just basic day-to-day things that you don't want to have to deal with. If you just deal with it when I did an in-service by the OB department to tell them when they're doing your 6-week postpartum visit, look for this and look for this. Have your patient Kegel. Feel if you feel the bladder coming down, being loose. Now I'm having patients who are coming to me with just basic things that we could work on that are so easy to work on, as opposed to them coming to me with stage 4 prolapse. And now it took you 30 years to get here. How long do you think it'll take to fix? Like, just just deal with it. Work on it now. If you're peeing when you're jumping, if you're having leaking, if you're having any of these symptoms, if you're having anything, just deal with it. Work with it. You have so many resources at your doorstep. Do it. Just do it.
There you have it. You can reach out to Leah on Instagram, Leah Klein Pelvic Health.